There's an old Japanese story about a young man whose mother decides to climb into the mountains to die, which was expected in their society back in the old ages. When you were no longer helpful or useful, you'd climb up into the mountains and you'd disappear. And as the story goes, the young man goes out to the rice fields to work. When he comes home, his mother is gone. And he climbs up into the mountains to rescue her and bring her back. And he carries her protestingly back to their home. And the next day he goes to the rice fields and she climbs back up into the mountains. And this happens 3 times that he climbs into the mountains and carries her home. And she then agrees to allow him to take care of her in her old age and as she dies. And the Japanese date that story to when they became a civilized society. And I think hospice brings civilization to our society.
I was walking down the street one morning, and there was a lady in front of me, and I started walking with her, and I said, "Well, how are you doing?" I said, and she said, "Not so good." I said, "Oh, what happened?" "My husband died last night." "He did? Was there anybody with you?" "No, I was all alone." My words were, "That can't be. That can't be a woman living across the street from a hospital, sitting alone with her dying husband." It was a time when hospice was just barely beginning, and to get this hospice started, I used the word hospice kind of tongue-in-cheek because we didn't have anything of hospice, but we had the desire.
We're very excited to bring this to the community, really to support the great work that is done by our staff and really ensure that we can continue to offer the really important programs that we have at hospice and home care. We get such diverse stories, but each one of them comes to us with such a soft heart that it really shows me the importance of the work that we do. And we are helping families at their most tender, vulnerable part of life because they're saying goodbye to one of their loved ones.
My mom had pretty severe Alzheimer's and had trip and fallen.
Her health care was deteriorating at a very fast rate. And I don't think Cheryl and I both knew that she was really getting very close.
Hospice gave us the link of what really to expect, and that's what we didn't know.
Somebody was in charge, and you didn't have that feeling that it was all on you.
It was overwhelming to realize that we had gotten to this point. And probably more so for my husband. He really wasn't quite ready for it. But the nurse that came that day was so gentle and so unassuming, and just, I can't say that she didn't pay attention to that because I'm sure she felt it. But she overcame that barrier in no time at all, and he liked her a lot.
It was nice to talk about anything that she had, that she was open to us, anything about. And it was very comforting to know that anything we asked her, she knew how to answer it properly and what was going to transpire through this part of our lives.
Riley, my bride of 49 years, was a nurse at a hospital for 40 years. We discovered that just 2 months after she retired, they diagnosed her with Parkinson's disease. And she struggled with that for 8 long years. Her vital systems were beginning to shut down. And of course they said, it's time for hospice. The hospice nurse, Amber, oh, she was amazing. She appreciated Riley's nursing background, and so she knew Riley needed lots of feedback on her vital signs, the procedures that Amber wanted to perform. It was that after that very first visit from Amber, Riley turned to me after she left and she said, with a little tear in her eye, she said, she's really good. She is really good. And I'm so glad that we're doing this.
Well, for my mom, as my dad was passing away, and for my mother-in-law when my father-in-law was passing away, it provided them help in a lot of different ways. Obviously, it provided them help physically with the medication and the care that my dad and my father-in-law needed. But I think what it really provided them was a comfort in knowing somebody was always there. They are truly special people. They have a skill and a heart that goes beyond anybody you can imagine.
You have to be able to walk in regardless of the diagnosis, regardless of the age of the patient. So I have to be just as knowledgeable of the end-of-life issues for a 3-month-old as I do a 103-year-old. I have to be able to come into that family and not tell them how to do it, but walk with them while they do it. Most of our families have never done this before, so I've been doing this for 20 years. So when a family calls and the message is, we're scared, we don't know what to do, we don't know if what we're doing is right, then my job is to be able to go in there, look at what they're doing, give them suggestions if they need any, and then just support them to help them get through this process.
Feeling very privileged to be given permission to enter people's homes, to be present with them during this journey, and to help them really have quality of life and not be afraid of hospice. That hospice isn't giving up, hospice is hope.
If there wasn't that kind of support, what would we be doing to help each other? There'd be no organization. We'd all be trying to, figure it out for ourselves. And this way, we've got help and it's available to everyone. It's interesting to visit with all these different people because there's always the common thread. And it's the joy that hospice brings to the experience that we're all going to have.
There are a lot of things that as a physician that I know that I can do. I know how to use medications to stave off death when appropriate. I know how to use them to make people comfortable. But there are a lot of things that I can't do. And those are the things that I think that tug at you sometimes. I can't make the young patient who has children at home, I can't make help their children really understand what's happening. I can't make that better. I can help them understand their disease. I can help them come to grips with what's happening in that way, but I can't help them decide what their legacy is going to be to their family. I think that hospice helps fill in some of those gaps.
I think from my vantage point as a doctor who's been in practice for 15 or 20 years, is that the hospice team model is really, truly the model of care that everybody really should be getting. It's interdisciplinary, where everybody sits at the table and the patients and their families are in the center of that conversation. So it's doctors, nurses, social workers, chaplains, volunteers, home health aides, pharmacists, nurse practitioners, all are sitting together around one patient and family.
Well, hospice helped me by educating me that this was not something that was the end of the road, the options. Now I have hope, I have a plan, and a message to carry, not only to family, but to people outside your group who believe that they hear the word and they think that's your death sentence, when in fact It is not.
We started Camp Aaron with the Moyers 10 years ago, and it is such an integral part of our bereavement program now. Camp Aaron has helped literally hundreds of kids in our community who have lost a loved one, and it's put them in touch with other kids who have also lost a loved one, gives them the opportunity to be normal and understand where grief is and where they're at in it and how they can be helped. I think a great commitment on our part is to offer this program, offer this camp to the kids at no charge, because we don't ever want finances to be the reason somebody can't get the kind of grief care that they need.
It really is amazing to be able to see kids transform in about 36 hours, to see them come with their families and be scared to let go of maybe a remaining parent or their siblings, and to see them connect with their big buddies and the other camp staff, and to watch them open up, even the very first night, to relate with other kids. And you know, very often I've had people say, it's 2 days. What can you do in 2 days? And to be able to watch kids talk for the very first time about their dad that died, or to see kids cry for the very first time, or say the words, I'm really angry that my mom is no longer here. That's transformative. And to be able to be a part of that, I don't know that there are words for that part.
Essentially, the hearthstones are clay hearts, and on each heart is imprinted a specific word, and they're kept in a lovely purple velveteen bag. And oftentimes when I go out to see one of our home care patients, I will bring the bag of hearthstones with me, and at the end of our visit, I'll invite the patient to take a heart out, and whatever is the word that is on that particular heart, that's kind of their word to ponder. It's their heart to contemplate until the next time I come for a visit, when they put that heart back in the bag and choose another one.
We provide service in nursing homes. We provide service in lots of different settings within this community. But again, hospice isn't just about helping the patient walk through their life. It's also about giving bereavement services for a year after that patient passes away to the family, so that we help them walk through the normal grief process. So again, hospice isn't just about that walk. It's about a continuum of care, from the first breath to the last breath, and helping families live through that.